Okay, good afternoon. Welcome for this talk, 2020, a year without public space. My name is Hendrik. I'm an associate professor in the School of Architecture of the Chinese University of Hong Kong. Before I start with my talk, I just want to explain to you some housekeeping. Basically, we disenabled the chat button. So the way you can send me questions, or it's basically you can select here under chat, and then I hope you can see the slide. You can select a speaker. So in this case, this is Hendrik TIEBEN. And then you can write me your questions. And here's basically one is for mobile users, this is for computer. And at the end of the talk, I hope we will still have a little bit of time. I will read through the questions and then pick some questions to answer according to the time that we have. Okay, so starting now, basically this is a talk of, which is part of a longer series of the Faculty of Social Science, which is basically focusing on COVID-19 between basically May and June in this year. Before I start to talk about the pandemic and COVID-19, I want to give you a little bit of an idea what my work usually is. So I'm an architect. I'm teaching in the architecture school and urban design. For example, in addition to my teaching, what I'm doing with students and community groups in Hong Kong is thinking about public spaces. So we see here basically New York under COVID-19, but basically this is a situation not under COVID-19, and where we were thinking together with different NGOs and secondary schools how we can improve public spaces in Hong Kong. And then we run different activities. This is just a simulation. And then, for example, invited secondary school students. Some of you now listening might be even also be secondary school students. They work with us together and made, for example, films about their neighborhood, and then we showed them in public space. And we were thinking how we can use better those kind of public spaces in the city. Just some images. In addition to this work in community, I became recently more and more interested in the relationship between cities and the physical form of cities that I'm usually looking at as an urban designer or architect, and the impact of the way how we design the cities and on health and well-being of the people living in the cities. So this, for example, a project that we are developing with University of Auckland and University of Sydney in Taiwan. Now, what then happened, we all, of course, were very surprised in the time around the Chinese New Year with the outbreak of the pandemic. And that, of course, interrupted a lot of our activities. So in our case, we shifted all our teaching, all our work to be online, but also for our research, for the kind of projects that I showed you before, it was very difficult to think about like, how can we do this kind of research under those conditions? Because, for example, when we usually work with local communities, I cannot tell my students to go out and talk with people in the local community because it would be made way too dangerous and also not even allowed. So for a couple of weeks, everything was in limbo. We were looking at basically the way how we could organize our teaching in this new form. But then after a short time, the question also came up, what can we actually do under this particular condition, and can we somehow contribute to help? So this is a graphic that I took from a website, and these are the attributed authors of this graphic. But I liked this graphic in a way because it was asking, who do I want to be during COVID-19, and to see, as long as we stay relatively passive, we feel our life is very much enclosed by the circumstances, and we have fear, we feel frustrated, and it's a very uncomfortable feeling. And of course, when people are infected, of course, it's even worse. But for those of us that maybe not are infected, we just feel kind of disempowered. But from the moment on where we basically embrace the situation and say like, well, I had different plans for this year. I wanted to do something different, but maybe there are also opportunities that if we embrace the situation, because it's anyway there, and then to try, how can we contribute, how can we help others, or do something meaningful in this particular period. Particularly for me, interesting because I was already interested in public space and also in health and well-being in cities. So I felt like I should find a way to react to this. Now, another point was that around March and April, we could see how all of a sudden, very quickly, the virus from the Asian part here, China, Hong Kong, Taiwan, was spreading more and more in other parts of the world. And I felt sometimes also seeing how unprepared maybe some other parts of the world seemed. Is there anything we can share from being here in this part of the world where we basically experienced the virus much earlier, and contribute with this? But on the other hand, of course, it's not that we are experts necessarily, but also exchange our experience with others and see what we can learn from them. Now, the particular situation of Hong Kong, mainland China, Taiwan was that here in this part, there had been the Sars epidemic. At that time, I wasn't yet in Hong Kong. I came in 2006, not in 2003. But of course, we know that this period was very important. And not only this, but also, sorry for a little bit disturbing image, but there is a long history, as many of you probably know, between epidemics, health crises, and the way the city is planned, and also how people are reacting and living in the city. So this image on the top shows basically people infected under the bubonic plague in 1894. And many of you might have heard that the first public space that was basically designed as a community space, more in a residential area, was basically designed in this context, I think King's George Park, basically turning down buildings where the virus had spread and create a public space for the residents. There's another image of the Sars epidemic. After the Sars epidemic, a lot of research was done. I know even in my school, a lot of colleagues had made studies on air ventilation, air quality, and so forth, and how the way how we design cities can be optimized or made better to also help the health in the city. And of course, we also see how residents in Hong Kong, I think, already are very much used to these kind of conditions. They keep distance, they might buy food in the takeout, they wear masks, and so on. So I think there were, I think, a number of things that I think that one can contribute maybe, or people that lived through this time, not necessarily me, but those people that really experienced SARS here, and share with other parts of the world, and certainly something that also helped to prepare for the COVID-19 pandemic when it arrived in this year. Now, for me personally, a way I found my own way maybe to engage with this situation was that already before I had a strong relationship to a journal, the Journal of Public Space. This is an online academic journal, but the beauty of this journal is that it's entirely open access. So everyone in the world, like a public space, can have access to this place and download papers. And maybe because of this open access policy, also UN Habitat became a partner of this journal. UN Habitat, not every one of you might know what kind of organization this is. This is basically the United Nations Human Settlement Program. It's kind of comparable with, let's say, UNESCO for questions of culture and education, or the WHO as the World Organization for Health. UN Habitat is a similar organization for everything that is related to the built environment, particularly in particular urban areas, maybe slum areas, or areas that are very problematic, and how we can help with a more sustainable urbanization process. Now, because of this relationship, I asked the editor-in-chief of this journal, which is Luisa Bravo, if we not want to launch a campaign under the name 2020, a year without public space, because basically every one of us made this experience that it became very, very difficult to go out. And usually, I believe for us who are passionate about public space, it's sometimes difficult to explain to other people what is public space, why it's important. But all of a sudden, there's basically a global audience, many, many people that all of a sudden don't have access to public space, and because of that reason, might actually see what is so valuable in terms of the outdoor spaces where we usually meet other people, make exercises, and get relaxation, or also run businesses, and so on. So we basically set up this initiative and asked a whole range of our friends and colleagues in different universities, and also made an open call for others to come and join us. And basically now we have a list of around 20 partners in many international places that are part of this initiative. And with this initiative, we organize webinars. So every Thursday around in the afternoon, we organize sessions with speakers from all over the world to think about and reflect about their experience under COVID-19 related to urban design, health, public space, and share their views. So in fact, if you want, you can Google basically the Journal of Public Space, and you will see there's a whole series of talks every Thursday with speakers, for example, of the Global Public Space Program of the United Nations or UN Habitat, with professors and activists from Seattle, from New York, from Zimbabwe, from Ecuador, and from many different places. And this is still kind of ongoing. Now, one thing that is kind of interesting when we look at the numbers of casualties and death, it is quite surprising. This is not the newest number, is in the 20th of May, but for Hong Kong it's still quite similar. Basically, it looks like Hong Kong, in comparison to many other places, very successful in the sense of a very small number of casualties, and also the number of infections very, very low in comparison, particularly when we see that originally the virus was first discovered in Wuhan, and there were, of course, massive kind of movements of people between mainland China and Hong Kong, and nevertheless, the numbers are very low. So this looks like a great success. However, I believe if we look more into details, I think it's also interesting to see how we can still improve maybe the reaction to a pandemic, and maybe the situation is a bit more complex than these numbers. Particularly, I think many of you might be aware of this, that Hong Kong, of course, has particular conditions, particularly in urban areas like Shamshupo, also in other areas, where we know that people live in very, very cramped conditions. And we know these kind of photos, but I use this here because it's relatively easy to imagine how difficult it is for a family living in these conditions to practice social distancing, how to run online education if kids, maybe both kids need to have online classes and so forth. This is very, very complicated. And basically what we did for one of our webinars, we invited Dr. Van Ning, among other people, but I was just kind of very interested in his talk in this webinar series and his work, because as a surgeon and public health expert, at the same time, he is very active in, after he launched an organization which is Health in Action, and basically tries to help working poor families, I think minorities and refugees, on the front line, particularly also in subdivided flats and so on. And the more you're studying the conditions and the situation of people there at the moment, you see how problematic the situation is, and also how maybe the biggest fear at the moment is not necessarily only the infection, but also all kind of other related problems related to domestic violence, family members that lose their jobs, economic hardship, and so forth. So I think these are all very important parts, and particularly for those parts of the society that live already so cramped, public spaces, indoor and outdoor, so parks, or also libraries, which are indoor public spaces, community centers, all these spaces are very, very important, and many of them were actually closed and created or further created a problematic situation of the population. Now, I took this slide from Van Ning's presentation. In fact, you can see the webinar with his talk also on this website. So Health in Action is here writing, the right to health is an inclusive right extending not only to timely and appropriate health care, but also to the underlying determinants of health. So I was very intrigued by this graphic because we see here, and particularly I was intrigued by this because a medical doctor showed this, that actually healthcare itself might be only 20% in terms of the determinant factors for health. So medicine, surgeries, maybe a vaccine, but there are many, many other factors that are very, very essential. And here you see, for example, physical environment, that is basically the field where I'm working, but also health behavior might also be affected by the environment, by the physical environment, because it either allows certain kind of behaviors, healthy behaviors, or make it very, very difficult. So for my personal work, I felt this was kind of very interesting graphic, and also showed that we designers and planners should take an active role in helping here. Another thing that is basically related to this is that we saw in Hong Kong, also very early in mainland China, but now, as you know, with the big protests in the United States, that not everyone is affected in the same way by the virus. Of course, every one of us can be infected, but what it means to be infected and also the likelihood to be infected is very different according to your social status, potentially also to your ethnic background and so on, right? And Hong Kong is a part of this, and basically I showed this already for the condition of those people that have to live in coffin homes or subdivided flats. But of course, for us, what's interesting now with our webinar series and initiative to understand and also compare how this global pandemic is kind of, this epidemic becomes a pandemic, is basically going almost to every country in the world. And in many places, we see basically the same patterns. Now, at the moment, in fact, in this week, yesterday we organized an international workshop. Through this, related also to our initiative on designing inclusive and resilient communities for the post-COVID era, or it's written here underneath, I don't know if you can see it, the new normal. And this is basically a collaboration where we work with teachers and researchers in New York, Parsons School of Design in Manhattan, University of Auckland, and also the Journal of Public Space. Oh, there's the spelling. In fact, we started this work already last year. We already worked with the school from New York together, and usually in our urban design program, we are fortunate that we always can take students on travel. And so last year we went to go to New York and looked at different public spaces. Now, this year, this was of course not possible because of the health crisis. But then on the other hand, we still had to offer those courses because otherwise my students cannot do their credit points. But also we felt like, can we use this particular situation and invent new forms of teaching where we exchange knowledge and learn together about this crisis. In this case, we looked at public spaces along the line number 7, which is in New York, a train line, MTA line, which is also called the International Express because it, or the Immigrant Express also, because it goes from Hudson Yards and the High Line, the most expensive parts in Manhattan, all the way to Queens, and pass through all those different immigrant communities with people from Southeast Asia, from Latin America, and at the end, ending in Flushing, with basically the last stop being the little Hong Kong of New York. And similarly, as we studied New York, we studied also with students basically the red line in Hong Kong that goes from Central all the way to Sham Shui Po to Chun Wan. And it's interesting how those different areas differ. So in our idea of studying the differences, because we had seen basically the health discrepancy basically here before, we felt this could be something interesting, like a section through the city and through those different income groups. And at the same time also an infrastructure which is actually used by many people, particularly also the urban, the less rich people that basically often need to go from their residential areas in Sham Shui Po or in Queens to Manhattan or to Central. So basically now, from today onwards, my students have to study different sites. So one is Hudson Yards. It's basically a development that was completed last year in March. And it's the most expensive development in North America. And we see here the IFC Mall in Hong Kong. And linked to those financial districts and shopping malls is a system of public spaces. For example, the world famous High Line, amazing, fantastic public space that was created, private initiative on an old railway, elevated railway track and became a kind of linear elevated park. Or also we have the footbridge system in Central. On the other hand, students are currently studying, and we had inputs from teachers from New York this morning, public spaces in those more immigrant communities and low-income communities, and to look at like how those spaces look like. Now, this one is a particularly interesting one, Corona Plaza, not only because of the name, of course, is one reason we took this, but also because this public space was built with a particular government program that allowed communities to build their own public spaces, and the government, the transport department, would basically help to implement those designs. Now, the interesting thing is when we look at those very beautiful public spaces that are world famous and attract millions of visitors, that not necessarily, and which have costs of billions of dollars, or millions, sorry, that you would think this is, of course, a fantastic space, and also maybe even in a crisis when people feel bad, it maybe could cheer up people, or maybe they can do exercises. However, in reality, what happened in this space is one of the first things that happened was basically the first park that closed in New York was this kind of extremely expensive and high-end and beautiful public space, the High Line. And similarly, the entire Hudson Yards, a shopping mall with a huge new public space, also this space was closed. So while there were $1 million of investments and parts of this into public space and private development and so on, many of those places were basically shut down immediately and were no more be accessible for the public. However, those much more mundane places that are managed for, I think, a kind of little fraction of the budget per year with very humble means, those spaces remained open because they are part of the street space, and they could not or were not kind of locked down. The other thing is that because this public space, particularly Corona Plaza, was not just built by the government as complete design, but basically the design and the activities were basically organized by the local communities, or by communities, different communities in the area, mainly from Latin America. Now these, because of this kind of very strong interlinkage between the public space and the communities, even when now the next photo shows the current situation. This is now not, the other one was, one of it was my own photo on the, here basically when we traveled. These are our students, and Miodrag Mitracinovic, our teacher from Parson, who gave us a tour. Now the current situation, of course, I haven't seen myself, although today we talked with a professor from New York who lives just kind of around the block and is basically a local resident in Queens near Corona Plaza. We can see that at least this place is not locked down. And the other thing is, because of all those different community events that at the moment are not possible, but because these events happened before and the community came together, now this community works as a kind of social network that try to help other people, because there's not much kind of government support at the moment for those people. And much of the support comes mainly through community groups. Now, as I mentioned, Corona Plaza is basically designed by the transport department, co-designed by the community, but built by the transport department in New York. Now we see as part, it was before a street space, and that was transformed into a public space. And now what we see at this moment in many places, that there is initiative to change streets into public spaces that are multifunctional and where people can do all kind of activities, but also because at the moment there are not so many cars there, to recapture those spaces for the residents, that they have more space, they don't infect each other, but also have a higher quality of living. So many people, here's even an article about the car as a virus, and basically the idea of recapturing, for example, politicians can prevent that the virus of the car is basically occupying the whole city. And we see now those tactical interventions a little bit. I don't want to say compare necessarily our work with this, but what is maybe similar, that these works that I showed at the beginning, those kind of tactical, low-budget interventions that try to carve out space for residents and create kind of more space to do social distancing, but on the other hand, also to have a breathing space in the city. We know in Hong Kong there was an initiative like this in DVRC, Devaux Road Central, which already started, I think, at the beginning of the 2000s. Unfortunately, is not yet realized. And it's also a bit sad that at the moment we don't see any kind of initiative, let's say, from the authorities to think about, well, maybe it would be a moment to recapture, rethink those kind of proposals and maybe rethink the city as it is done in Amsterdam, in Milan, in New York, and Philadelphia, in many cities in the world at the moment. Now, another question when we think about the future of the city is basically the question of urban density. Now, many people in United States, for example, now are very nervous, or also maybe in Europe, that potentially, because they look at New York and they feel like, oh, so many people were infected, so we shouldn't live in those high density cities. However, of course, high density or density in general has also a lot of advantages, because it is much easier to potentially to afford social services and infrastructures, and also people don't not necessarily need to have cars. So sometimes big cities are actually in this regard sometimes more greener than suburban areas. But I think it's important in this discussion about density, this is from the Bloomberg School of Public Health, just a headline, is density COVID-19's best friend? But also in this article, basically, they already say, wait a minute, because maybe it's not like all cities work so bad. There are actually particular Asian cities that work actually not too bad under this virus experience. And in fact, it's also interesting to see that those areas that are worst hit by the virus in New York, for example, this is an image of New York. This is Manhattan, that is basically the iconic New York that we know. However, the worst place at the moment in terms of the pandemic is basically the area here. Corona Plaza, the area that I showed before, which is basically not a high-rise area. It's not particularly dense, you would think. So you can see the most cases are exactly where Corona Plaza is. And here's a high-rise city of Manhattan. And this has to do also with different forms of how we can think about urban density. Because we can measure urban density in different ways. It is, on one hand, maybe the size of the buildings. Do we have a high-rise or a low-rise building? How many apartments are in those buildings? And the next thing is how many people actually live in those buildings. And what we see that in the case of New York, for example, the problem is not necessarily to have very big houses, but the problem is, even though you have very small houses there, because the real estate is and the rents are so expensive that many, particularly migrants that move to the city, have to live in shared apartments, basically in subdivided apartments, same way like in Shamshupo. And with the spread of the virus, with just one toilet for maybe 5, 6, or 10 people, many of them in essential jobs, maybe drivers and working every day outside, maybe even have 2 or 3 jobs. If one is infected, the whole family or even several families get infected. So if we look at this area of Corona Plaza, coming from Hong Kong, this looks not like high density. This looks like low density, actually. However, in terms of living density and crowdedness, is one of the most crowded places in New York, because many people live in this kind of very small flats together. And because of that, unfortunately, we're infecting each other. Many of those people also are not health insured and so on. Now, coming to the question, basically, how can we now plan and design future cities and public spaces for the post-COVID era or the new normal. New normal also because we don't know really if there will be a post-COVID, if the virus or other virus will be entirely disappearing, or maybe they stay for some time. What can we do? Now, I believe we can learn from current situations of different cities. That's why we do these studies also. And basically, as I said, maybe something like Corona Plaza, a space that was designed with the local community, has some kind of quality. It was not a big investment, relatively cheap, but creates an important part for the community and has helped to build a community sense that is also now in the crisis important. But on the other hand, of course, New York was very unprepared for the virus in terms of other points, because maybe it didn't went through SARS before. And that's why I believe being here in Hong Kong, it's quite interesting to look at particularly those cities that were affected before by SARS, and can we learn something from those cities? Now, I said already, Hong Kong in the statistics looks very, very successful. However, we have already seen, because Hong Kong has this very strong gap between rich and poor, and this incredibly expensive housing situation with people living incredibly cramped. So those people might not be infected by directly the virus, but might go through the crisis with horrible mental health problems, with domestic violence, and really a lot of sad stories, losing their jobs, and so on. Now, there are, of course, other cities that also went through SARS. Now, what happened when the virus basically started to move from Wuhan, at least where it was discovered, to other places. It happened that I was at that time in Taipei for the Chinese New Year. And I stayed for several weeks there before I went back to Hong Kong. And what I found very interesting there is that because of very good direct reaction, the entire Taiwan could basically avoid a lockdown. Public spaces were not locked down. All shops could still be open. And people continued to use the public space. But of course, this could only be made by a lot of contact tracing, being very vigilant to see like who is infected and then to find out what can be done. And but because that was done, you can see how people then use public space. And what is interesting, similar to public space, maybe we could see in Hong Kong, but in Hong Kong, all the different functions would be divided by fences and only be for one group. But then it's like, for example, this is just a place for basketball. But then that's very difficult because there's so many people who want to use those public spaces. So these spaces, in fact, I went running every day there. You had people that go running, that just walk after having a dinner, or that play, or some elderly that would just sit here and have a breathing space. So these public spaces, they are not so fancy like the High Line. They have not the same level of sophisticated designs maybe, but because they were multifunctional and flexible, they could be used for many, many uses in the crisis. Also because Taiwan went through earthquakes and need, in the case of an earthquake, those spaces for people to escape. Now, I have to stop soon. Here you see other spaces in front of the city that basically use where artificial wetlands were created basically to save the city from flooding. But this investment into this environmental protection also now was very, very successful during the crisis, because it was a fantastic place where on the weekends people could gather, or basically could do activities, many, many activities, without having the problem to necessarily meet too many people too close. And but this space is a little bit closer than our country parks, to the urban area. So it's basically from the urban areas, you can go basically along the entire river here. The other thing is that this space also could be used for alternative forms of mobility. For example, many people use the shared bikes, the biking system. And you see an incredible investment into biking and public space investment. I think I would assume in Hong Kong, we would never find such a kind of ambitious bridge built just for people to sit and enjoy their time and ride with or go from one side of the river to the other with a bicycle. Or this flexibility, again, the same space can then be used for concerts and so on. And in this kind of very oppressive time of the virus, people were very nervous, could basically spend in those places. Now, what I want to say is maybe the new normal, the cities might not be entirely different, because if we learn from places how to well organize our response to COVID-19, is not necessarily said that we always have to go through those very problematic lockdowns. The other thing is that those investments into public space might be really something that people can use every day, but also in the crises. I summarized some of those points that I find are very important. So of course, has to have trust in the community and also the government. There has to be health provision, housing and masks and internet, all those things has to be there also. It's not only public space. Flexible public spaces in dense areas, not only in the country parks, right? Infrastructures, as I showed you, for example, those wetland parks and so on, they are good for environment and health and well-being. Now we can use online face-to-face support networks for people to help each other. I think this is very important. And also remember, I showed you those tactical urbanism interventions. They were often done with very low cost price and not waiting for planning for 10 years, but basically directly trying to help immediately and testing out those things. It doesn't need to be forever, but I think to help people in a crisis situation. Now, this is basically what I want to tell you about maybe who we want to be, or for me, maybe what I want to do under COVID-19. So, but also because many of you are also maybe secondary school students, you think about your future. And I feel like you can be a part of the people helping in many different ways. You can be a medical doctor in many parts, you can be in education. In our case, I work in this part of architecture, urban studies, and urban design, where we do this work. But of course, we work together, for example, with Faculty of Social Science on many of those aspects. So this is my presentation. If you want to find more materials, you can go to those websites. There's a YouTube channel, and if you Google Journal of Public Space, you find all those videos, also by this Dr. Fan Ning, or from New York, from many places, and you can learn more. And now what I will do now is, the time is actually already up, but I still offer, for those of you that feel that they are need to move on, please move on. But if you want to ask me some questions, you can do this now. Maybe I can still answer maybe to one or two questions. Are there any questions that there's a question about, of course, a question of closing borders relatively early in Taiwan. I think that without being, I believe, to react early and control borders is, of course, an important part in the protection. I think China is doing this also. I think Hong Kong did this at some point. And I think maybe if more countries would have done this early, they could have controlled potentially the virus spread a little bit easier. But I think that's something I cannot prove with my own research. It's just a kind of. I think you cannot speak with your microphone. There's a question if you can speak with a microphone. For security reasons, in these kind of webinars, you basically can write a question and I can answer it. So if there's still a question. Okay, there is a question of how cities were designed differently after SARS. I would say that in Hong Kong, what I know from my colleagues that were in the SARS period here in Hong Kong, they did a lot of research on aspects of air ventilation and trying to create urban environments that are more healthy in general. And then of course also to look at, I think also, there was a study of, for example, the tubing and so on in housing estates to make it safe. There were attempts to design new outline zoning plans to implement those rules. Not all have been implemented. I've noticed there's another question. Let me. Oh yeah, there is a question between East and West in dealing with the crisis. Yeah, the question of stay home. So let me try if I can answer to this. I think cultural difference, yes, that is true. But I wonder if, of course, at the moment, there's a big discussion about the mask. And I must say, being in Asia, I felt it absolutely unresponsible how many people in the West didn't wear masks. Looking from here, I had questions why this happened. Although, first of all, I'm not sure if it's in the cultural DNA of people in Hong Kong or Taiwan or mainland China to wear masks. I think that's also a particular experience after SARS, or maybe also already a little bit before, I don't know, and became a very important part. And I think if we would have another outbreak in Europe, I'm sure people would wear more masks. I'm pretty sure about this. That's a behavior. Let me just read what you write. There is a question about indoor public space and if there are changes after the pandemic. I think that is a very important part. We see that in many cases, even with the climate of Hong Kong, where usually people always like to be in shopping malls, that there was, and also Taiwan, Hong Kong, I believe also in mainland China, that there's a very strong urge to go into outdoor spaces to enjoy the countryside. However, I think the problem, and which is great, we have this amazing country parks here in Hong Kong. The problem is for many people that what we heard from people, for example, in Sham Shui Po, that live under these kind of very cramped conditions and would need desperately public space. For them, it's often impossible to reach those country parks. So I believe that there need to be some kind of other adjustments to have more valuable public spaces in the dense urban areas, for example, by using some of the streets as public spaces, but also the point of the use of indoor public spaces, for other aspects, very essential. For example, many libraries were closed under the pandemic, and other government facilities, universities, and one has to re-examine how this is possible in the future. If we need to close them, probably we need, but in Taiwan, they were not closed because the libraries are very important resource centers where there's free available internet. There is space for students to study, particularly those that live in these very crowded conditions. So I believe it's something that is kind of very essential to think in the future, what can we do with these otherwise very important public space infrastructures, including indoor public spaces, particularly libraries and schools and so on. What can they do during a crisis. For example, I'm reading just the last question, maybe. Yeah, I think that it's about the size of the public spaces, if one should have big or small ones and so on. I think that the question, I think, is often also the accessibility of those parks, particularly for the people, that vulnerable groups. Of course, having big parks is very good in this during a pandemic, maybe, but for many people, particularly in the crisis situation where they not want to go too long outside, use public transport and so on, they might not be able to reach these spaces. So that's one of one has to evaluate. This, not necessarily an easy answer, but it is of course possible in cities, and many cities have done this, to basically use more street spaces as public spaces by having much wider sidewalks, or even have some streets that not have all the time cars. So I think the street spaces are probably something we have to look very closely into using those, because, for example, in Jamshedpur, we cannot build a big park in Jamshedpur, then we have to kick out everyone living there, right? So, but streets are there, and there were streets that were used for street markets. Why not also some streets can be used more for green spaces? So I would say now, I don't want to make it longer because I'm already 15 minutes over the time. So it was a pleasure to talk for you. Unfortunately, I cannot see you, but I hope that is somehow useful for you, this talk. And particularly, I also want to again suggest, if because I might not know everything, obviously, but also if you have particular specialist question of public space, there are many webinars by many people, also in New York by the Public Space Research Group and so on. But if you want, you can also look at our webinars, because each week we try to focus on one particular topic. For example, one was health disparity and public space. One was on public space and informal settlements. And then we had webinars on artists' response, creative approaches to the virus. It was a very popular video because many people felt probably a bit more cheerful to see like how people try to do the best in this crisis situation to give hope to others. So this is maybe a good resource. Otherwise, you can also send me an email if you Google my name at CUHK. It's very easy to do that. Okay, so thank you very much for joining. That's it for today. Yeah.